About 10% of the population will have an abdominal hernia. However, the majority of abdominal hernias occur in males. We spoke with Dr. Michael Zadeh of Valley Presbyterian Hospital in the San Fernando Valley to learn about a new minimally invasive procedure to repair hernias.
Think of a hernia as a hole in the abdominal wall, and the way it forms is you have a weakening in the muscles of the abdominal wall. And what happens when the hernia forms is that your abdominal organs, mainly fat or intestines, protrude or come out and bulge through this hole and get stuck. And that's where you can run into problems.
The doctor told us about the symptoms of a hernia.
But the main symptoms are usually pain. You feel pain at the hernia site. The most common sites of the hernias are in the belly button or the groin or at the site of a previous surgical scar. So most commonly you'll feel pain at the site. You may or may not see a bulge, especially during straining or physical activity. The classic diagnosis is made by physical exam. If there's any doubt in the diagnosis, there are tests such as CT scan or ultrasound which may help in the diagnosis, but classically your physician makes the diagnosis with physical exam.
Dr. Zadeh described the procedure for repairing a hernia.
Well, the only real way to treat a hernia is by surgery. And the reason we like to operate on these is because if the hernia does get stuck and there is intestinal contents involved, then the blood supply to the intestines may get cut off, and that would necessitate an emergency surgery and possibly removal of that portion of the intestine. So that's why we'd like to operate on them as soon as they're diagnosed under elective conditions. Single port surgery is the latest advancement in the field of minimally invasive surgery. And what it involves is making a tiny 2-centimeter incision in the patient's belly button. And through this incision, we put our surgical instruments, and we're able to accomplish a variety of procedures right through the belly button. And the result is less pain for the patient and a virtually invisible scar. So we've come from, let's say, 20 years ago, where we used to make 6-inch long incisions and have patients stay in the hospital for 2 to 3 days for such a procedure, to making a 2-centimeter invisible incision in the belly button and having patients go home the same day after the procedure with minimal pain and returning to activities a lot sooner than, say, the conventional traditional procedure.